The January 4th deadline looms for nearly 17 million healthcare workers across the U.S. to get vaccinated against COVID-19.
Lucas, for the past several weeks, I've contacted 14 hospitals across in Missouri and found several had 40% of their workforces unvaccinated. Tonight, ABC 17 News investigates what kind of effect this vaccine mandate could have on staffing at hospitals and what that means for your care.
When you talk to people in the urban area, you talk to people in the rural area, they still can't get the staff.
The third floor of the Bothwell Regional Health Center in Sedalia was known as the orthopedic floor.
And we were doing orthopedic surgeries here, and people get knee replacements, hip replacements. It's a 13-bed unit.
A floor that once housed patients, now empty.
So this is fully ready to go if you were able to have enough staff.
Correct.
The third floor shut down back in February. Steve Davis, who has worked at the hospital for more than 30 years, says there was not enough staff to keep it operational.
Do you see this opening up anytime soon?
No. I don't know if we'll ever get enough staff to open this back up.
Davis told me right now Bothwell Regional has 87 nursing positions open. To open the third floor, 36 additional nurses would need to be hired. Davis fears staffing shortages may get worse due to a federal vaccine mandate. The Biden administration is requiring healthcare providers who receive Medicare or Medicaid funding to have employees vaccinated against COVID-19 without the option for weekly testing. I contacted 14 mid-Missouri hospitals to get their employee vaccination rate. Out of the 6 that got back to me, here's the breakdown. Truman VA, 91%. Here at Boone Health, 85%. MU Healthcare, 99%. Fulton State Hospital, 65%. Bothwell Regional, 67%. Phelps Health, 61%. Both rural hospitals in Pettis and Phelps County still had about 40% of their staff considered unvaccinated. In March of 2020, the beginning of the pandemic, there was 1,011 employees working at Bothwell Regional. In October of 2021, there are now 906. Out of those employees, about 65 people said in an internal survey they would likely leave the job if they are forced to get a COVID-19 vaccine.
So, for employers of our size, it could be very devastating for us to do that.
So what does all of this mean for a patient? Well, Brock Slabback with the Rural Hospital Association told me hospitals will have to reallocate staff to make sure priority areas are covered, and in some cases, surgery departments could close.
If surgery is closed, it's going to put off maybe a cholecystectomy or a hip repair, and that could create some downstream troubles for patients not getting the service when they need it.
Whether staffing shortages are because of a vaccine mandate or other reasons, shortages are not something new for hospitals. Dr. Robin Blunt, Chief Medical Officer with Boone Health, says healthcare workers were leaving even prior to the pandemic.
Whether it's burnout or just other concerns. And the national nursing shortage is real.
To help with those shortages, hiring travel nurses has become a must for some hospitals to stay open, but it's coming at a cost.
Contract labor alone last month here was $1.4 million, and that's just in 1 month.
Our hospitals are paying that because they're forced to, but in the long term, this is going to be terribly detrimental financially for these facilities.
In the meantime, Davis is hopeful that a new rural residency program at Bothwell Regional will help attract future physicians and more staff.
And that's going to start next year. We were doing that as a way because in rural Missouri, it's hard to get physicians.
Dave Dillon with the Missouri Hospital Association told me so far it hasn't seen any mass terminations or resignations because of a COVID-19 mandate.